So we're going to talk about some important acts that affect special education in American education reform. So starting in 2004, the important act, the Individuals with Disabilities Act, was reauthorized. It is basically an update of an older act that was in place to protect special education students. The IDEA, Individuals with Disabilities Act, was signed by George Bush, the reauthorization of it. And in the reauthorization of it, the important points were to make sure that special education children were educated in the least restrictive environment with a free, appropriate public education. Now, that was in the old law, PL 94142, but some of the updates included the procedural guidelines and parent involvement. So it wasn't just enough to evaluate the student, it was that the parent had to be more involved, and the districts and the school were mandated to have parents obtain procedural guidelines if they did not know the procedure and they had more rights. Also, on the educational part of it, this mirrored the No Child Left Behind Act as well, that there was a greater accountability in instruction and discipline of special ed students, that students should be, whenever possible, educated in the general education setting. Now, this includes a range of services, of course, because not every student was eligible for special education, but we look at who is eligible for special education, and they updated the way that students are evaluated, that evaluations had to be done in a timely fashion, and that parents had some more additional rights. Now, fast forward to 2011, there was a reauthorization called the Individuals with Disabilities Improvement Act. And the purpose of that act was to recognize a few classifications that are appearing more frequently, such as students with learning disabilities were always classified by, when the evaluator was testing them, there was a discrepancy between performance and potential. So there were students with specific learning disabilities who would not get services, but they updated it. So if you had tested in one area as having a specific learning disability, such as reading or mathematics, you now could get services. So specific learning disabilities were added. They also had traumatic brain injury that was added, and also autism was more well recognized. Another aspect of the IDEIA is that now children birth to 21 were now included on the range of receiving services, whereas before it was just age 3 to 21. There were some other improvements, such as the need for early intervention, the look at the overall compliance, making sure that schools who receive money were now compliant, the addition of additional related services, such as adding a chance to be evaluated for more speech, and also there were some operational changes as well. All of this was made to be more parental friendly and to give aid to the school districts to give them more ability to promote these services. One of the other things that became very important was to prevent or identify special education earlier. So not only were people able to get early intervention services, which means before kindergarten, but to be entitled to some services to prevent special education And also when the school-age children were suspected of having a disability, there would be a program in place whereas districts and schools would have to do intervention. They couldn't just put a student into special education without trying different things first. So this is one of the reforms. It kind of mirrors what's going on in various countries, and on the instructional level, there's a push for more team teaching and students to be educated in the general education environment. I think that's happening in your country as well. And the next video, I'm going to talk a lot about Race to the Top. Thank you, everybody, and have a good day. Guten Tag and auf Wiedersehen.